Now, it's said to be the second cause of death globally. Now, the mention of the word cancer sends shivers down the spine of most people. The reason is not far-fetched. The myth built around the disease doesn't help matters. Now, sadly, some say it as a death sentence waiting to happen. And the matter of fact is that the psychological effects is even worse for most people. And I'm sure you don't want to know what such patients go through trying to see that this disease does not get to them. Now, with over 8.8 million cancer deaths recorded globally on a yearly basis, the burden of the disease has put pressure not just on the patient, but on the Nigerian economy, as most patients tend to seek medical help abroad. Now, encouraging capital flight with the alarming prediction that Nigeria should expect a 75% increase in cancer-induced death come the year 2030. The picture doesn't look good. The question is, what can be done to reverse this number, and how can we kick cancer out? Well, I'm sure there are medical lines to actually attend to that. Now, medical facilities to manage the disease in Nigeria, how are they ready to actually attend to that? Where does the government come in to the picture? And what role can the private sector play in tackling the disease? The questions certainly are more. Let's get to find answers with my guests in the studio. My name is Blessing Abu, and you're welcome to Nigeria Today. Yes, welcome. The program is Nigeria Today, and with me in the studio, I'd like to start from my immediate left. Let me welcome Ronsi Chidebe, is the Executive Director of Project Pink Blue. Welcome to the program.
Thank you very much, Blessing.
And we also like to welcome our friend all the way from New York. We have Tracy O'Connor. She is an associate professor, a medical oncologist with the Roswell Park Cancer Center. Welcome to Abuja and welcome to Nigeria.
Thank you for having me.
Yes, I know this is one great concern for you, which had to make you travel all the way down here to see how you can actually join hands with what Nigerian government is doing here. Let's talk about cancer, really. Why the myth, why the fear, and what is it that we must actually fear about cancer?
I think that people are very frightened of mortality, of dying of cancer, and they're afraid that they detect a cancer that's necessarily going to happen. What we do know is that if cancers are detected early, many of them are readily curable. So the point is really to try to encourage screening to allow for earlier detection of many cancers, things like breast cancer that can be detected via mammography. If they're caught early, they're highly curable. So I think the point is to encourage more patients to seek screening so that they can be diagnosed at a much earlier stage.
You're quite right. Early presentation. Now, Chidebe, we know this is one thing that most people will not just want to do until it's late, and that is the concern for medical practitioners around this side. Stage 1, stage 2, I'm told it could still be managed, but once it gets to 3rd and 4th stage, which usually is when people now say, okay, now they're running helter-skelter. Why is it that our people actually still fall on that lane?
So you see, we have this attitude that if we are not carried to the hospital, we don't go to the hospital. You know, we'll always find ways to just visit some small chemist or some small centers to just get some medicine to just take care of it. So that's a very big issue, and it's important, and thank you for NTA for doing what you are doing in terms of creating awareness, because what we are doing right now is extremely important in getting people to know if you see any symptom, any lump whatsoever on your breast as a woman, you have to ensure you go to the hospital to get it checked. If you are also a man, you are older, you know, so this symptom.
When you say older now, that shows it has to get to a certain stage or a certain age for it to start. Okay. Now let's find out for the men what.
For instance, for breast cancer, that that is extremely, on the prevalence rate in Nigeria is actually the highest. So for every woman, so far as you are a woman, you are at risk of having breast cancer. So far as you're a woman. So once you see any lump or once you see any change, and that's why we keep telling people, the breast aware, know your breast. If you know your breast, if there are any changes, you will instantly know that this is not the way it was yesterday. Something has happened, and then you can get it checked.
Okay. Let's take the female angle, of course, as a medical doctor too. I know you see different patients from time to time. And is it particularly different for race to race, or is just a universal stuff?
I mean, in the
what should we look out for beyond what you have said?
Sure. In the United States, there are definitely ethnic differences in terms of accepting information, comfort with cancer diagnoses, and seeking screening. But most of these changes can just be fixed with education. So I think the more that you educate people, and the more that they see that when they get things checked early and they're treated properly, that the outcome can be really good, that will encourage more and more people to go and get screened.
Okay, let's push this further. We're told that some of what death-induced cancers, of course, is more to a behavioral and dietary risk. Can you talk more about that? Because it's just enough to say, okay, because I'm a woman, I'm predisposed to having cancer. Are there things I've been doing, or I've started doing, or are likely to do that could get me into such a state of cancerous or malignant, as you people put it?
Well, for breast cancer, the risk factors, the biggest one is being female, just like Renzi said, of course. It does happen in men, but it's pretty rare. Okay. Although if men notice a breast mass, they should absolutely bring it to their doctor's attention, because it does happen. Overweight is a risk factor. Alcohol consumption is a risk factor. Family history is a very important risk factor for breast cancer. So knowing your family history, if your mom or your grandmother had had a breast cancer, that's important to report to your physician and to keep in mind. So all of these things can be risk factors for the development of a breast cancer.
Okay, well I'll still stay with you. Now to check, now we're trying to get this awareness strong enough for ladies or for women to check what time of the month, or is that a particular time, and what should they look out for?
You know, in the United States at this point, we really promote breast awareness. I always tell my patients that you live with your breasts, and I just visit them once a month or once every few months. So it's just as Renzi was saying, a fit time to do a check of your breast, to look in the mirror to see if there's any skin dimpling, and a regular exam. But we've moved a little bit away from encouraging people to do things on a complete schedule. I encourage my patients to check themselves once a month, but I don't really prescribe a time to do that.
Okay. Well, Doctor, now sometimes we find it very difficult to say, okay, now that you've discovered this is what is wrong with you, now going for screening or going for check will put some kind of pressure on some people, and it said do not touch until it's damaged, like you said, people like until they're carried into the hospital. Now people are getting impoverished by the day, overspending medical bills, that is even when it is available. Now what have you observed, what are the kind of statistics we have there about people's cases being answered at least hospitals, kind of facilities? Do we have enough to actually go around?
Yeah, so actually in terms of cancer incidence in Nigeria, is really high. You know, in Nigeria today you have over 103,000 people are diagnosed of cancer every year in Nigeria, different types of cancer. Breast cancer is actually highest, followed by prostate cancer, then followed by cervical cancer, and then followed by colorectal cancer, and other cancer like Kaposi sarcoma, that is HIV.
What is that?
Which is HIV induced, and other colorectal and other cancers, and other leukemia and blood cancers. But you see, in all fairness, we really do not have sufficient infrastructure to really take care of the number of cancer incidents that we have. We also do not have sufficient manpower and sufficient radiotherapy centers that are working to take care of these cancer patients, because the number is increasing, and that's really why we have more people dying of the disease, because sometimes they have to wait for a very long time to even get a result from diagnosis. Sometimes they also have to wait a very long time to get radiotherapy. Yeah, and also quality of life is also very important in, you know, for people who, you know, that they got this stage 3, stage 4, as you said. They shouldn't die in pain, you know. They should die with their dignity intact, you know. So
what are we doing? Now you've talked about insufficient manpower. You've talked about the facilities not really there. So, but where do we have these facilities that people can actually watch out for, maybe across the nation? Where and where have you seen?
Okay, so I think it's important for me to mention this, that we also discovered that most physicians are not as much interested to go into oncology.
Why is it so?
Than like in other area of medicine. The reason is that there are more deaths happening around the area of oncology. So, for instance, a doctor who focuses in maybe, would be gynecology or obstetric or maybe family medicine where you help take baby and stuff like that. It comes with joy, you understand. But for cancer, because of the death, almost a great percentage of people who are diagnosed of cancer in Nigeria and in most part of Africa die. So you as a doctor, you really do not get anything that makes you
give you such morbid feeling.
Exactly. It doesn't really encourage you. So it's an issue. And there is a need to really provide more skills for the doctors, encourage more people to go into oncology care, including pathology.
Could it be because of the insufficient institutes or facilities that is discouraging the doctors too from going to that aspect from this part?
Exactly, because there are so many things that could be used to actually provide care for patients that are not available. For instance, we don't have any PET scan in the country. We as I speak to you today,
all over the country?
All over the country. I speak to you today. We just have only 2 places where you can do bone scan in the entire country.
So where does Dr. Tracy Okada come in here? What is the interplay that you have to come down? What is it that you're trying to do?
Well, the main focus of this endeavor with Project Pink Blue is the education of, I think there's 44 Nigerian oncologists that are coming to the program.
44?
44, yeah. So it's a large number, very enthusiastic, very interested in what we're doing. And my colleague Mike Martin and I, along with Dr. Nwama, I can't say his last name, Obina. Yes. Okay. Designed a curriculum to review and go over the current state of the art as well as what's possible local, regionally for many different disease sites.
Okay.
So I did reviews for breast cancer treatment. We've covered GI cancer treatment, prostate cancer. So really just an update on how things are going and what the hope for the future can be.
Okay. Well, once we get back from this break to take on some respondent who actually spoke with us earlier in the day, I'll get to find out from you what you shared with us 44 doctors at least that you've met, or some of them that you've met.
Sure.
Their enthusiasm, like you said, and some other gray areas that they are talking to you about on what they could do to actually make it better. All right. You're watching Nigeria Today, and our focus is on improving cancer treatment in Nigeria, even though it's management. We'll take a pause at this moment and go to the street.
I don't know what is the matter. I know there is a growth in some signs, they say in the lungs, in the breast, or in some say private part cancer. I don't really know what it means.
I'm sorry, please. I don't know about this cancer.
I know. I'm actually aware.
I don't really know anything about cancer. It's cancer. I know that cancer used to kill somebody, but I don't really know anything that cancer does.
No, I don't know the causes, but I know that it kills.
Now that's shocking. I don't know, and truly some people don't know. They just know that, okay, this person died of cancer. Perhaps now we get back to that education really about what cancer is and what way it manifests for people.
So cancer is a disordered growth of cells. So these cells have the ability to continue to grow abnormally and without stopping. Our usual cells have regular signals that will tell them to stop growing. When they touch other cells, they will stop proliferating and multiplying. Whereas a cancer cell has a very disordered growth and will continue to grow and spread unless it's properly treated.
Isn't it shocking for you that most of the respondents, they just don't know? So what more awareness or advocacy do we need to do to actually put this in the mind of people?
Yeah, you see, so I would really say that right now the awareness has increased, but I was watching this video, I felt very pained in my heart that even as much as we are doing, it still shows that what we are doing is not enough. It means we are doing practically nothing. So I think we need to do more, especially in the area of reaching out to the local people, translating this information, because not everyone have access to social media. not everyone have access to internet. So it means we have a lot of work to do. And I'm also grateful that just a couple of months back, the Federal Ministry of Health launched the National Cancer Control Plan for 2018 to 2022.
Exactly.
Yeah, so it means that we are showing some commitment to fighting cancer in Nigeria. But I mean, what it means now is that we should now match this policy with action to ensure that this information reach out to the people.
Yes, earlier we talked about some of the constraints. Now let's take a look at some of these key barriers to how do we begin to redirect our attention, redirect our energy, and also redirect what other plans that you, or that's yourself, as well as other private concerns are actually looking at. How do we begin to address some of these key barriers?
Yeah, so you see, the truth is that the key barrier to cancer care in Nigeria is funds, is resources. You understand? There is a huge competing factor in funding cancer patients in Nigeria. So the federal government want to fund every aspect of healthcare, but when they look at it, they see, polio is pushing too high, malaria is here, and then cancer is also pulling out. So there is competing, huge competition in priority. You understand? But the truth is that we all have to also understand that we are losing our mentors. We're losing the old people who we run back to for wisdom. If we totally just don't give priority to cancer and other NCDs, you'll see that someday we'll have all young population, but we won't have your older people that could provide guidance.
Even those days, you get to find some young persons being infected.
Exactly, yeah, you understand. So what am I trying to say is that there is a need for a focus to cancer. And there is also a need for state governments to provide and budget for cancer care.
Okay, I know, because I was going to ask, okay, beyond the federal government, what are the other subnational levels doing to actually tap into what you are here to address?
Yeah.
Okay, let's get back to Tracy. Now, for you, meeting with some of those oncologists that you've had to be with in the last 3, 4, 5 days, what were they telling you, and what was it you were reading from the activities?
Well, it's really very touching because they're trying very hard to take good care of their patients with limited resources. So I have almost an embarrassment of riches to take care of my patients. It's very easy for me to get access to any medicines I really want, radiotherapy, high surgical procedures. And really, they are every day trying to do the best for the patients in front of them, and they don't have access to all of the tools that I have. So part of it has been sharing information, thinking about regimens that might be, utilized here in a more limited resource environment that could be helpful, and also reviewing the state of the art, because as things improve, we do think that some of these therapies will be translatable.
I know also about that aspect, at least some of the other areas of looking into maybe telemedicine. Would you be looking into that with them as well?
Yeah, actually I do that now with some colleagues from Lagos. We do some Skype consultation from back home to here. So it's been a good process to try to discuss cases and talk about options.
Okay, all right. What other things are we looking at based on this, your partnership with the federal government? Because I know you said over time there has been some kind of collaboration.
Yeah, so when the federal government launched the National Cancer Control Plan, Professor Isaac Adewolo mentioned clearly and called on all stakeholders, private sector, to support the government effort in cancer control. And Project Pinglu answered the call with this program known as Upgrade Oncology. So what we're doing is that we've brought 44 cancer doctors from all parts of Nigeria who are already seeing cancer patients, and Dr. Tracy and Martin are providing care to them. And thanks to the U.S. Embassy who helped us in providing support to bring them in here. Yeah, so it's important for every stakeholder to support the government. Let me give you an example. Today we are all celebrating Bill and Melinda Gates Foundation for all their support in the area of HIV/AIDS. You understand? Today we are talking about Tony Elmelu, who is supporting entrepreneurship. But we have other millionaires across everywhere. We have Femi Otedola. What is it doing? We have so many other people.
Maybe he's doing some other things, maybe not necessarily health.
Yeah, but what we're saying now is that we need all aspects, everyone needs to support. We need companies, we need corporate organizations, one way or the other, to pick different
So in what
areas.
area now that you're seeking, this is an opportunity, now that you're seeking assistance from everyone
Yeah.
who is someone,
One
where,
most,
in each of the states of the Federation, what do you need? You've had 44 people come in to actually look into, so what are they saying the need in their respective public health institutions?
for instance, in the whole of South, there is no single radiotherapy center. There is no single radiotherapy machine that is working in the whole of South Nigeria.
So where do the patients go to?
All the patients who are diagnosed of cancer and need radiotherapy travel all the way from the whole of South to either Abuja or they probably travel to Enugu. Yes. And the whole of South West, as I speak to you, the only radiotherapy center that is working currently as I speak to you is only Ibadan. Lagos has been off for a very long time. And then the whole of North Central.
But she said she's been talking to some colleagues from
That's
Lagos.
not machine. She's talking about
interaction.
telemedicine with
Okay.
it,
Okay.
And then, so apart from radiotherapy, also cost of the drugs are also a very big issue. Another important issue that people also need to look at is training. Training for the truth is that you cannot give what you don't have.
Sure.
So if people don't have the right skill, they cannot give the right care. If they have poor knowledge about treatment, they will give poor.
So what are you doing in the aspect of training now? This part of
Exactly,
it? This part
exactly.
Of,
This
this
is part of
okay.
it,
They
yeah.
go back to now retrain.
Exactly.
Okay.
Retrain
So
other
what other areas now? Okay, we just about Southwest. Up north is just the Abuja.
And up north is just Abuja. Sokoto was working a couple of weeks back. I don't know if it's still working now, and then Gombe only have brachytherapy that is working. So, overall, the truth is there is a need to really give priority to cancer care, and people can really also look at the area of diagnosis. The area of diagnosis is very, very important. Sometimes it takes so much time to get some diagnosis done for patients, So this is also a very important area where people can dive in. Because you see, cancer itself comes with a lot of burden.
Seriously?
For me, I don't see cancer as just a disease. I see it as a burden. Anyone who has cancer, it affects not just the person, the family, the husband, the children,
Wife.
almost everyone around them, the workplace. Why? Listen to what those people on the street said. Out of 5 of them, 2 of them said, I know it's something that kills person, kill. So the whole family are just filled with that mindset that
So this
kill.
my loved one is going to die.
That is it. So we need psychological support.
Yes, I think that
Very important.
Let's bring in Dr. Tracy now. For sufferers. What kind of advice do you give to them when they come? So that could provide support to families now who are watching, who know that their loved ones are still going through this, or eventually for those, who don't pray for such, but then it happens. So how do you counsel them? How do you take care of their concerns psychologically?
Well, the first thing that I do to encourage women is to, or I see mostly women because I'm a breast cancer doctor, but to encourage patients is to always remind everyone that early diagnosis does lead to cure in many cases. And if cure is not possible, treatment to relieve symptoms is always possible. I encourage my patients to participate in support groups, to meet with other women and patients struggling with the disease, and to have conversations and to share their experiences. And we try to arrange those for our patients.
Okay.
Referral to counselors can also be helpful, and extra support for the family. So we have sessions for the children and families where they can talk together with other children whose mothers have breast cancer, and that's been a great support.
Yes, I know earlier you talked about a behavioral pattern which people should actually avoid. Are there dietary implications to that will help?
Well, in general, eating a heart-healthy, low-fat diet and maintaining a healthy body weight is important in cancer prevention. Staying physically active is important. So those are things that are within our control to do that modify the risk.
For those who love to get such physical activities, some actually don't get to exercise. People actually run away from doing that here. So what other information do we need to get across to the public at this moment?
Yeah, so you see, screening is very important.
Yes,
really need screening is absolutely important because
how cheap is it to go for screening? Because I think sometimes too, some of those things we consider, okay, it's just one of those things, actually a burden for some.
Yeah. I mean, I agree with you, it's expensive, yeah, but the truth is that if you check the cost of you preventing what you can prevent, and then the cost of that coming up with that, you really know that it's better you prevent it.
But there are screening machines, at least that's going
yes, there are screening machines.
All over.
And interestingly, there is also HPV vaccine, which we all can help to give to our young girls to prevent cervical cancer. You understand? Same as also for hepatitis. People don't even know that high viral load of hepatitis can lead to liver cancer. And you see, people don't even know, and so prevention is very important. People being able to at least take HPV vaccine, people who can afford it, and also to go for screening like breast cancer screening, prostate cancer screening. And if you've had any of your relation, probably who had come up with colorectal cancer, you should always probably pick up colonoscopy at least once every year.
What does that involve?
Well, colonoscopy in some facilities are not really expensive. You can get colonoscopy for like maybe 20-something thousand or 40-something thousand, once every year. But it's very important if you had a relation who had colon cancer.
Okay. Yeah. Last word from Dr. O'Connor.
It's just been a really remarkable experience coming here, seeing the hospitals, talking with the oncologists. I've learned a great deal. I'm hopeful that this project will be helpful to them, and that with these interactions we'll be able to foster better ideas for the future.
I hope so too. Thank you very much. I'd like to appreciate you, Dr. Tracy O'Connor, medical oncologist and associate professor, Roswell Park Cancer Center, New York. It's your second time, you said, coming to Nigeria. I'm sure you're loving Abuja City.
I am loving it. Thank you for hosting me.
Okay. Also, Ronsi Chidebe, Executive Director, Project Pink Blue. Thank you for coming on the program.
Thank you so much for hosting us. Thank you to NTA.
And God to you. We appreciate you for watching. Please make sure you check yourself and get to see that you're fine. We'll see you again on Monday, 7:30 in the evening for another interesting discussion on Nigeria Today. You can actually watch this edition or any other edition at all on www.youtube.com/NTA News 24 Hub. My name is Blessing Abu. Enjoy your weekend.